In about 2 hours, we could see our government shut down for the first time since the 1990s. This is a live look at the nation's capital, where members of both the House and the Senate have been fighting it out all day over an agreement to fund the federal government. Now, tonight, the Republican-controlled House refuses to pass an amendment that includes funding for the president's affordable health care law.
On the flip side, the Democratic-controlled Senate refuses to pass a plan without the funding. Right now, lawmakers have until midnight Eastern for the House and Senate to pass the same funding bill, sending it to the president's desk. About an hour ago, the House approved a plan that would delay affordable health care. Minutes ago, that died in the Senate. This has been the story pretty much all day. The president is putting pressure on both parties now to agree.
Congress has two responsibilities: pass a budget, pay the bills.
Well, it's not likely to happen, but if a bill does pass both the House and Senate that defunds affordable health care, the president says he will veto it. If a bill is not passed, some government services will shut down and workers will be off the job. The Affordable Health Care Act is at the center of this debate tonight as new health exchanges actually open up tomorrow.
That's right, and a lot of people in Tennessee are involved. Nearly 900,000 Tennesseans will soon have access to health care coverage regardless of any pre-existing conditions. Still, there's a lot of confusion about what it really means for you and your family. With that, John Dunn in studio with more.
Scott, about 85% of Tennesseans who already have health insurance won't see much of a difference tomorrow. But for the uninsured, October 1st has been circled on their calendars for quite some time.
Joyce Coggin is almost constantly sick.
I have what they call chronic bronchitis and asthma, which I was born with.
For several years, the 55-year-old has lived without health insurance. But on Tuesday, she'll be able to apply for coverage through new health insurance exchanges.
I think it's great for people that don't have it, people that have a lot of health problems like I do.
It all starts online at healthcare.gov. Think of it as a shopping mall where individuals and families can shop and sign up for coverage, choosing between dozens of health plans.
Do I want a really generous plan that has a high premium, or do I want a less generous plan?
Vanderbilt's John Graves is an expert on the Affordable Care Act. With few exceptions, it requires all Americans to have health insurance by next year or pay a penalty. The new health plans are not free. The average premium under the cheapest bronze plan will be about $181 per month. A better silver plan will cost around $235 a month. The good news, Tennesseans will enjoy some of the lowest rates in the nation, and tax credits will help reduce costs.
You might be eligible for a new federal tax credit that will offset your monthly premiums for that private coverage that you purchase in the marketplace.
Joyce Coggin says she's tired of worrying every time she needs to see a doctor or buy medicine.
I've been looking forward to this for a long time.
She's not paying attention to the politics in Washington. For her, the Affordable Care Act is about peace of mind.
Although folks can start signing up for coverage tomorrow, now the new plans, they won't take effect until January 1st. And remember, if you're uninsured and don't sign up within the next 6 months, you could pay a penalty next year. Now, we've made it easier for you to find that website. Just go to fox17.com and click on Fox Links. John Dunn, Fox 17 News.